ideas and the old models of treatment.
I know when I worked in inpatient treatment that, we frequently would advise, clients, there'd be this fear that the person would go into overwhelm if they quit everything at once, and so then they would leave treatment entirely. And what we wanted to do was to have people feel some success with an initial drug of their choice and then gradually over time choose. And I guess part of what you're seeing is that that may have been the plan when somebody first gets clean and sober, but in reality what happens is they don't then make that next step of let's go ahead and let go of the cigarettes. Now, what about people who are not recovering alcoholics and addicts? Are they eligible for your treatment program?
Yeah, they are, but what's happened is we opened the door with this idea, and who shows up were the addicts and alcoholics who now wanted some help, and were very accustomed to group therapy and self-help support, so they just came right in and got real comfortable and really supported each other. The other folk who are not the addict population, they want to come in and pay $35 and come five weeks and be done with it. They have a different concept of what this is about. So a lot of it's the education. And the nicotine addict is at a different level. They're either thinking about doing it, which is pre-contemplation, or they're contemplating, meaning like, well, I think maybe I'd like to quit next month, or they're getting ready to take action. And most of the programs around are action-oriented. If your addict is at a pre-contemplation level, it doesn't match. He's not even sure he wants to quit yet, see? So a lot of the people who come in are just sort of checking it out, and we tell them this is a big commitment here. They say, well, I don't want to do that. Then we refer them out to a program that's more for their needs. The real key is you just keep trying. The average is 3.5 times. We've actually had people who've never tried to quit. We say, go try to quit. Go over here and do that and do that and do that, and then come, because the more times you try, the better your chances of making it.
Oh, so far from being discouraged if you have tried a couple times, not been able to do it, actually that's a good indicator that maybe you might be successful this time. That's a different way to think about it, actually. It's more hopeful.
Yeah, statistics support that the person who makes it has actually tried 3.5 times prior. Trying meaning actually making a commitment or actually having treatment.
Are either one of you recovering smokers?
I am.
You are?
Yeah, it'll be 10 years this February.
Wow.
Absolutely.
And how did you know it was time to stop smoking?
Well, it was, like Dr. Hazel said, it was my third attempt. I'd tried 2 times prior and made it 3 months one time and 6 months the second time. The third time I decided to go into a program, and I went into a program at Good Sam where I had group support and I was medically detoxed, and I think I was willing at that point. But what got me ready was everything in my life was yes to life. Everything in my life. I was exercising, I was doing well in my life emotionally. Everything I was doing was geared to living. And it got harder and harder for me. Every time I put that cigarette in my mouth, there was a disparity that went on that I could not come to terms with. So my love of myself, my self-esteem was just declining. And then I think vanity, being a woman. I think being a woman in this culture, one of the things I hear a lot from our women nicotine addicts is body image, body shame stuff. A lot of nicotine addiction for women is tied into losing weight. You bet. And having to keep that thin body that we're expected to keep in this culture to be worthwhile, worthy.
In fact, I wanted to ask you about that, because one of the objections that frequently my clients will have is, I'm going to gain weight, and in fact, they'll stop smoking, gain weight, immediately go back to smoking. How do you address that body image, weight gain question in your work?
Well, we've sort of taught them that we need to try to do everything we can to not gain weight. We've got to change some habits here. You're going to gain weight coming off of a stimulant drug you've been taking for 20 years. But now there's a research article that we have that shows the people who do not attempt to lose weight while they're abstaining do better, meaning that the recovery rates are better for the groups who do not try to lose weight at the same time. So actually you're defeating your own purpose if you even try to. You ought to allow yourself to gain the extra 15% of body weight that you're going to gain, and then you're going to be dealing with that later on as you learn how to exercise and diet correctly.
So then there is a nutritional component in your program that says, okay, now here's how I can take care of myself after I've stopped smoking.
Well, also one of the things, Mary, that we've added has to do for the women in particular, and I know it's true for the men also, but for the women, we have devised a women's group, and it has a lot of empowerment tools that we teach there. And I think it's important to bring the feminist therapies into this, because so much of it does have to do with this body image. I noticed on your break you had one of the images of women. I've looked back at the old advertisement and some of the new ones, for that matter. Virginia Slim.
Yeah.
Virginia Slim.
That's right.
You know, this will make me slim. So I like to bring in a lot of the feminist therapies into group also, and work on body image and acceptance of body image. Like doctors said, it's okay. If you gain 15 pounds, 12 pounds, whatever is going to happen, it's going to come off. But helping them to deal with the root of that image also. Where's that coming from? And give them a lot of support.
Just speaking of support, is there a family component in your program, a chance for significant others to come and participate?
We just added that to our
did?
program.
Okay.
Yeah, just added that this
And
month.
how does that work?
It's very much like other addiction programs in that they're going to come in once per month, and they're going to come in for 2 hours on a Saturday afternoon and have a place for themselves.
Okay, so then the significant others can talk about how they feel about the changes your patients are making. Well, that's good, because it addresses that issue of ambivalence that we talked about last week regarding change.
And remember, enabling is an issue, too.
Yeah.
I had one client who relapsed maybe 4 months ago, and when he let go of cigarettes, what happened, it was his last drug, and when he let go of it, his rage appeared. His rage emerged, and it became very uncomfortable for his wife, the rage that was going on. And of course, I think that she was not intentionally trying to sabotage his recovery. That was not conscious on her part, but in essence what happened is she went and bought the cigarettes and gave them to him.
It's kind of like when I've had clients whose partner said, I liked you better when you were drinking.
Right.
Sounds like this is the same situation, which is, well, at
Absolutely.
least if you're smoking, you're you know, in better control of your feelings.
Yeah.
In fact, isn't there a component of cigarette smoking itself, the smoke, that it does have a numbing effect emotionally? I've had clients talk about that, then they just don't feel as intensely.
Oh yeah, it's a very interesting drug based on how you inhale it, and almost like your mindset. It can be very relaxing, very soothing, or it can be very stimulating based on how you take the drug. And one of the other ways is visually. How you dispense the smoke will have an effect on how you feel. One of the ways they've treated nicotine addiction is to blindfold people when they smoke. And if you can't see it, it takes a lot of the power out of the nicotine. There's a very, very strong psychological component, you know, the smell, the ritual, the visual to it. And even though we put people on nicotine patches, they have steady state nicotine levels, they go through craving, they go through hunger, they go through all these things that are all visual or tactile. They gotta, you know, where's that thing, you know?
That's right. Well, it's, you know, I've had people say, well, you know, every time the phone rings, I pick up the phone with this hand and I want to pick up a cigarette with the other. So addressing those cues.
Right. Every time I put the key in my car door, I want to smoke. It's like every time I start my car, I get a dose of cocaine. Yeah, after a while, you kind of connect that.
That's
know?
right, you do. So why quit, right?
Yeah.
What kind of, why do people come into your program? I mean, what is, are they usually referred by physicians? Have they begun, you mentioned the client who had the oxygen tank. I mean, are they usually, have they had some physical complications by the time they get to you?
Well, I'd say a majority are probably 20, 30-year smokers, and a lot of them have physical consequences. How they've come to us is basically word of mouth, because we really haven't advertised or promoted this, because we've kind of been waiting to see how it would go. But it's like Chris had an article in a local health journal, and one of the women who read that called us, and then there was an AA woman who called her friend, and it's been word of mouth, which actually is good because these people are motivated. When they come in, they want to do something, and they're willing to tolerate what we'll present to them. A lot of people call up and they hear over the phone what we want them to do, and they're not ready.
They're not ready to do that. So you do have assessment counselors, people that, let's say, I just wanted to check you out. I mean, could I come in and talk for half an hour or an hour and see if I'm appropriate?
That's
or,
right.
And is that free? Do I have a free assessment?
No, it's you pay right up front.
You do?
And we want you to at least put down the amount of money you're spending on nicotine for the month.
Okay.
$1 bills on the counter.
How about that?
It's very shocking when you see it stacked up. People get a different view of what nicotine's about when you start doing just little things like that. It changes their perspective.
How did you decide to do it that way, for them to spend put down whatever they spend for the month? That's interesting.
I don't know. How did we decide?
That's very creative.
Probably over pancakes.
This whole thing started over pancakes.
Over pancakes?
Yeah.
Pancakes and peanut butter. I don't know, really.
Yeah. Really?
It's really blossomed from there.
Yeah, actually, it did. It was. I came back from a nicotine conference I go to every year, and I came back kind of revved up about nicotine again. And finally, I think Chris challenged me. She said, "Well, Bill, why don't you do something?"
Yeah, let's do something about it. Well, that's so Chris. Let's do something about
she
it.
said, "Let's do something." I said, "Well, yeah, I guess that called me, didn't it?"
Yeah. So at this point, your programs have been in existence, what, a few months? Or
No, it'd be a year.
a year. Wow, already.
A year in March, I think. Yeah, we kind of had our first patients and kind of opened the doors in March, and we started working on it the fall of '93. So pretty much last year was the development.
Okay.
And we've had a group now. Some of them are 9 months clean of clear is the term, clear of nicotine.
Clear of nicotine. Well, I want to thank you both for being with me today. This
Thank
has
you,
been
Mary.
very, very interesting. I'd like you to join us next week as we celebrate Valentine's Day, answering the question, why can't we leave when we say we will? I'm Mary Crocker Cook. We'll be here next week on Bay Area Psychology. Thank you very much.